Hi, I'm Lachey, and I'm a student nurse, and I have a patient who has not had a bowel movement in 3 days. So in this video, I'm going to demonstrate the administration of a cleansing enema, the administration of a suppository, and the placement of a bedpan. So before we begin, I've already checked my MAR. I've already checked that I had the right client, made sure I checked that she has no hemorrhoids or no fecal impaction, and I've assessed her bowel sounds. So she's good and she's ready for this. We begin by washing our hands. I'm placing our gloves. I have my client already in the left Sims position, her chuck underneath her. So I'm gonna go ahead and have our lube. I've checked the expiration date on her suppository and I made sure that this is the right suppository. So I'm gonna go ahead and place my lube in a cup. And so I'm gonna place the tip of this into the lubricant, and this is a water-based lubricant. I've let the patient know what we're doing. I made sure she was clean before I went ahead and applied this. And like I said, she is on the left Sims position. So I'm going to hold the superior cheek up. I'm going to insert. Tell her, okay, Susie, I'm going to insert on the count of 3, 1, 2, 3. And it is going in up towards the umbilicus about 3 to 4 inches. All right. Now, once that is done and I've inserted, I'm going to have her hold for about 5 to 15 minutes. All right, I'm taking off my gloves right after this and I'm washing my hands and I'm documenting that I just administered her suppository. Okay, now I'm going to demonstrate the administration of cleansing enema. Also, if she has, for this case, we want to make sure we check to see if she had any sort of trauma, any hair trauma, and she hasn't, so she's pretty good to go. I've already assessed her bowel sounds. So we have got our beautiful, nice and warm cleansing enema that has been had its soap suds instilled in nice warm water. So before we begin this, we've put in the amount of water that the doctor has ordered. We want to make sure that we prime this. So by priming, we're going to unclamp it, allowing the water to flow up until the tip. All right, so the water is here. Hang this about 12 to 18 inches above the patient. Now we have our cup, all right, and we have our lube. Okay, I'm gonna squeeze some lube in there, and then we're going to, because we've already clamped this back so it's no water coming out, we're going to make sure that we lubricate the tube for about 4 to 6 inches. And also I've let the patient know what we're doing. So providing maximum privacy, we want to have the patient just kind of take some deep breaths. So we're going in and we're going towards the umbilicus, and now we're inserting about 3 to 4 inches into the rectum, and we're going to unleash the clamp. All right, and at this point what we're doing is we're assessing our patient. We want to make sure that she's not having any vagal responses, which would be like a feeling of dizziness or even some sweat going. So we're going to have her hold this in. All right, she's holding, and most likely this patient's going to go right after, and she can't get up and go to the bathroom. So what we're going to do is we have a nice bedpan. We have our bedpan, and now before we take this out, we're going to make sure that we're wrapping it with a napkin and to dispose of it. But I would have disposed of that. And we have our bedpan. So we're going to have the bedpan, which we have our chuck under her too. We already have that underneath her. We're going to make sure we have her turned, and this bedpan is going to be placed at the hip. All right. All right, Susie, we're going to turn you over, making sure that the hips are aligned. All right, Susie, we're sitting the head of the bed up. Allow her to have her privacy here. I'm going to get her back, and we're going to come back and assess her. We would have also taken these off right after any suppository, and if they were contaminated, we would have made sure that we switched the gloves and put on new gloves and wash our hands in between. After this, I've washed my hands. I've documented that this has been done, and I'm going to make sure that I'm monitoring the patient. When I go back to check her stools, I want to check the color. I want to check the consistency. I want to check for any distension. You know, and also I would also assess her bowel sounds again to make sure that they are active in all 4 quadrants. And after that, we're leaving the patient in the lowest position. We make sure that her collar is within reach and she has everything that she needs. And that is going to be the end of this video. Before we begin, I've already done the implementation step. So I washed my hands and I've got my patient here. The first thing we want to do is that we clean this stoma off. As we're cleaning around it, we're looking at the color of the stoma, making sure that it's nice and pink, that there is no signs of infection, and that could be anything from like drainage, any inflammation or anything like that. She has none of that. First is we want to measure the stoma. Okay. So using our measuring tape, we're gonna see. Let's see. What we're looking for here is we don't want it to be too tight, but we also don't want it to be too loose, because too tight around it or too loose, because this skin here, like see, this is too large, because this skin could get have some irritation because of the bile that's coming out of the stoma. So we want to probably get about I'd say this looks good. This is a great size. Take our back here and we would measure about how much we want, and then we would cut around it. So I've cut it already for video purposes. I also want to make sure that before we place this on, that I've smoothed the edges out before placing it on. And I've also cleaned this area around the stoma with some skin prep adhesive, and then we'll make sure that this is folded. That way the client won't have any irritation on in this case. But we want to make sure that we have the bag firmly attached before placing this on. All right, and then we can apply some adhesive here that'll help this stick to the skin a little bit better. Okay, so we're going to go ahead and put that over the stoma, just like that, firmly pressing around it to make sure that it is sticking. We don't want to have any seepage or anything like that, so we want to make sure that this is nice and firm on that skin. All right, we have our clamp here, so we would have this on before we even apply that, and also try to keep the stoma covered, maybe if you have a patient who is having some diarrhea from the stoma or just fluids leaking out. To empty this stoma, let's just say that this is about more than halfway full. We want to grab a graduated cylinder, a napkin. Okay. What we're going to do is we're going to take our graduated cylinder and we're going to place it underneath here with a chuck being underneath it as well. And we are going to open the clamp, allowing this to drain into the cup. All right, and I have it under my chuck, and then I'm going to just clean the bag. Clean, and I'm holding it up this way so that way no more content could leak out. So I'm holding it upwards and I'm cleaning it, okay? All right, now I'm going to apply the clamp back on, just like this, folding and clamping. All right, so then it should look like this. Of course I wouldn't touch my phone, but just to give you a better view, I'd make sure it's in just like that. Okay, and then after this procedure, I want to make sure that I am looking at the consistency, checking the amount, and I'm writing down the amount that the patient had in the cylinder. And I'm also going to empty this, clean this out, and place it back into the patient's bathroom. And I'm going to wash my hands and document my findings. And that is it.